Hi everybody and welcome to UroChannel. My name is Stefan Buntrock. I'm a urologist and sexologist. Just to make it clear from the beginning, this is a medical video. Best settings for dick pics, the urological perspective. I am going to talk about cameras, lenses, light, color, angle, all the technical stuff to enable you to shoot the best possible picture of your penis and avoid typical mistakes. I know I'm walking a thin line here because this is highly sensitive content. Therefore, a warning before we really dig into the action. Do not, I repeat, do not send any pictures of your penis to anybody unless you are asked to do so. For most people, especially women, it is absolutely revolting and it can get you into conflict with the law. However, in a professional medical environment, dick pics are routine stuff. As a urologist, I need documentation, something to go back to in terms of diagnosis, course of the disease, and documentation of cure. Penile pathology demands documentation for medical records, and it helps the patients to explain their problem. We are talking about dermatological issues, like when there is a discoloration or inflammation of the penis, it is a good thing to just take a picture, because usually you don't get an appointment the same day. And by the time you sit in front of the doctor, things might have changed already. So it is a good thing to have something to show that illustrates your description. Because all too often, patients come into my office complaining of major penile pathology, which make pictures from textbooks appear before my inner eye. And when I examine the organ, I don't see a thing. The other important use for dick pics is Peyronie's disease. If you haven't heard of this disfiguring condition, check out my playlist. Shooting Peyronie's disease is difficult because you will have to get the angle right so that it is possible to assess the severity of the deformity. So the first point is what camera to use. Cameras of smartphones have become very good these days, and this is what almost everybody has in their pocket. My first tip is take a picture of the relevant pathology. If it is balanitis, then go close. If it is Peyronie's disease, choose a perspective that illustrates the deviation, preferably in a way so that the amount of the angulation can be assessed. For this, you will have to increase the distance a little. But don't take the camera too far away. Take the picture while standing. Point number 2 is light. Light is probably the most important part in photography in general. Without light, it is impossible to take a decent photo. For dick pics, flashlight is a no-go. You will get a nasty overexposure and light reflecting from the skin, which will mess up the colors. If possible, use natural light. Artificial lights like neon light and lamps are not suitable. This means take your picture in daylight. If you are close to a window, avoid to take the picture against the light. Backlit will mess with the automatic exposure of your camera, and as a result, the penis will be underexposed, something that has to be avoided. Don't take the photo directly by the window, as the light changes throughout the day. In the evening sun, the light is much warmer with lots of red colors than in the morning. This lets your penis appear more reddish, which makes diagnosis more difficult. If you take that picture farther away from the window, the light gets more diffuse and the quality better. Apart from that, there might be neighbors watching you. Tip number 3 is about the background you choose. Use something neutral, preferably plain and light, to make a good contrast to the penis. Background is also important because it is a detail of your photo which may distract from the main purpose of the photo. Tip number 4 is about sharpness. It is still possible to mess that up by holding the camera too close to the object, but as a rule, cameras have become so good at focusing that you don't have to worry about it anymore. Editing is tip number 5. Most of the time, there is no need for editing. However, if you are working on your photos, try to keep the colors as natural as possible. Some cameras are known for very colorful standard settings like GoPros. But in the clinical situation, it is more useful if you or the camera don't crank up the red. That'll make your penis problem look worse than it actually is. What about lenses? My advice is as close as possible to the human eye, which is approximately a 50mm lens, or the neutral setting of a smartphone. Especially wide-angle lenses have a tendency to distort the image if the camera is held in a certain angle. It can make a penis look enormous, much more than the standard lens. Tele lenses are good for the so-called bokeh effect. This is when the background gets very blurry, thus intensifying the sharp object in focus. This is achieved with a tele lens with the aperture wide open, and there has to be a certain distance between the object and the background. Some smartphones are able to simulate the bokeh effect. I hope you are now prepared if you have to see a urologist with a penile issue. Apart from that, I really advise you once again to keep your snake in the cage and don't take photos of it just for fun. If you want to impress someone, send flowers. Sounds old-fashioned but works wonders, believe me. Please subscribe, hit like and activate the bell. And don't send me any dick pics unless you are a patient and I asked you to do that. Thanks for watching. Bye bye.